Hello, everyone. Well, the theme for this brief talk is underestimated herbs. And there are certainly plenty of those. In fact, when you reflect on it, the herbs that are actually used in medical practice for therapy are a very, very small fraction of the number of botanical species out there. So we're only really scratching the surface. So we could say that the number of underestimated herbs is very large. I probably need to go for the next 100 years, maybe even to get close to covering them. But there's one in particular I like to talk about, and it was for a while, I think about the 1990s into the early 2000s, it was Australia's best-selling herb, practitioner, retail, you name it, for osteoarthritis. Can you guess what that herb is? It's celery seed. So there was literally, for a while there in Australia, a celery craze. And I can certainly tell you it works incredibly well for osteoarthritis. It's quite interesting to understand what killed off the celery craze too. So I'll go there a little bit later in this talk. So let's begin by looking at what was actually selling. And it was the liquid extracts of celery that are very high in phytochemicals known as phthalides. Now, don't confuse that with phthalates, which are in plastics. This is phthalides. So only very loosely related, and certainly none of the problems that phthalates have. And it's a bit of a mystery how it worked. I mean, when I was doing my herbal studies, I was taught celery helps clear acid from the body, and that's how it helps osteoarthritis. And hence, it's also a mainstay for me for gout and works incredibly well. But how did it work in osteoarthritis? We didn't really know. And then along came one of these big tax minimization schemes called Tory, Australian Tea Tree Oil Research Institute, and you could take shares in it, and that was immediately tax deductible and so on. And despite its name, yes, it was working on tea tree oil research, but it was also working on clinical research with celery, and they did quite a bit of impressive clinical work with it, and found that it was effective. I think even in rheumatoid arthritis, it was an effective anti-inflammatory. Now, unfortunately, that research has got lost for decades and probably will never reappear due to a wrangle with the Australian Tax Office and what have you. But funnily enough, there is clinical evidence to back it up. So generally, if I'm using celery liquid for osteoarthritis, I also use it in combination in tablet form with boswellia. But if that's not quite doing it, or maybe the patient prefers liquids, or there are other reasons, maybe they react to boswellia, some people do, I actually use the celery liquid straight as a simple 4 ml once to twice a day, and particularly in that twice a day dose of the celery liquid, the results are extraordinarily good. So it's very, very underestimated. Now, it's quite interesting because I visited many decades ago a researcher who, Dr. Phil Cheris, and he had this theory that osteoarthritis was basically a vascular condition, and you got these microthrombi happening in the microcirculation of the bone that then triggered inflammatory responses and denied the nutrition to the cartilage in the joint. And he actually, again, I think as part of this Tory, and again, I'm not too sure it's ever released, therefore, he had actually done some research where he showed that celery was incredibly good at thinning the blood in terms it reacted specifically to help prevent these microvascular clotting. Now, it's quite interesting. It's purely speculative, but we know that COVID infection is involved with microthrombi. A lot of the pathology from COVID is microthrombi. So who knows? There may be potential there. So what killed off the celery market? Well, the answer was that, of course, the modern consumer wants tablets. So a number of companies, wanting to jump on the bandwagon, launched celery tablet products into retail. However, when they were tested, and we tested them, they didn't contain anywhere near the level of phthalates, because the phthalates, they're not entirely volatile. You do find them in the volatile or essential oil, but they're much better extracted with liquid. But when you try and dry that liquid into a tablet, if you're not careful, you can lose them. And that was certainly happening in these retail products at the time. Yeah, as mentioned, I do use celery in tablet form, and the way it's produced does retain the activity. So there was this rush of ineffective products onto the marketplace, and consumers are not stupid, and thus endeth the celery craze. But give it a try. If for example, you're got a patient who's not responding with osteoarthritis to the current treatments, just try celery as a simple. It's disgusting, I know, but people get used to it. 4 ml with water, once or twice a day, and in many cases, you will be absolutely astounded by the results in osteoarthritis. If we look, just to finish off, if we look at traditional Chinese uses, and I'm talking here, of course, about the celery seed, they use the celery seed for vascular applications, similar to perhaps some of the research I was talking about, but also to lower blood pressure. So there's another potential there. And I see a patient with microvascular problems, with osteoarthritis, and with high blood pressure. All of those point to celery. So I'll often will give it as that simple. So there you go. Try the celery. But it's the seed you need. Each seed contains much, much more phthalates than the stalk. And so drinking celery juice in this context is not going to cut it. It has to be the seed, and especially the extract of it.